Forces loyal to Côte d'Ivoire's presidential claimant Alassane Ouattara extend their gains on the ground, but as the incumbent President Laurent Gbagbo clings to power, is the country sliding into civil war?
We first ran to Ghana during the war. After that, you had to go as a refugee, go into a camp and try to find your way. We saw people dying, we saw people on the road, we saw a lot of things. And in the camp also, we had to fight to find, even if we had the small toys, everybody wanted the same toys. To find food, it wasn't that easy. So the client came in, has been shot by military, and they came in hospital and they want me to save him. I couldn't do it because he lost a lot of blood before coming, so I recommend them to go to the higher level hospital. On the way to this higher hospital, the 3 clients had been shot by military, so they came back to look for me. First, I was hiding myself. They came to my house, and whatever they did, it wasn't good to myself and to my mind, so I wasn't feeling very good. My husband moving from Ivory Coast to United States, and also he had to find a job, and for me too. Unfortunately, we discovered that it would take me 5 or 7 years to become physician, and I couldn't do that. So they bring me a social worker, and I was telling her my story. So she was like, you know that we have the training starting JVS.
Elizabeth enrolled in the health worker training program in order to gain an entry point into the healthcare workforce in the United States. The training builds on a model where we train clients for specific roles in healthcare and then place them in paid internships in order to gain hands-on experience.
So every morning when I came in dressing, professional dress, and I see the other people walking so fast, going to work, me too, I'm walking to go to work. Who knows that I'm going to a training, I'm going to work. So I did my first cover letter, and I improved my resume, because my resume in Ivory Coast, you put your picture, your date of birth, your marital situation, all things. Yeah, I have to go through all this. And also I teach you how to do the picture elevator. This one helped me to find this job that I have right now. Yeah.
One activity we did as a group was the entire class volunteered at Project Homeless Connect. I thought it was a great opportunity for them to get out and network in the healthcare community.
At this event, I saw the director of DPH, and I thought to my classmates, this is a good time for me to make my speech elevator. I'm going to talk to the director of DPA, Barbara Garcia. So after I ran after her, and I came to her, and I was like, excuse me, ma'am, can I talk to you?
Elizabeth took that suggestion and really ran with it and approached the director of public health for San Francisco, Barbara Garcia, and gave her pitch.
So I gave her a piece of paper, and she writes a deputy director name. She was like, she's at 1380 Howard Street. She will help you. I did my internship, and everybody wanted me to stay there with them. And after they gave me the job, after my internship.
One of the best things about the JVS interns becoming permanent staff was that they came in with some very solid training from JVS about basic professional skills that they would need to be valuable employees in DPH. We had an opportunity to work with them as interns and see how they fit into our clinic in the best way. So when positions became available, they were the perfect candidates.
Elizabeth is with the health department today because of this career pathway collaboration with JVS. She is the first person you meet when you walk into the Behavioral Health Access Center. This is a center where you have folks who are at their worst in terms of challenges and impediments. And so she's there, and she is the first one who de-escalates situations. She calms clients down, and she provides the care that's needed for clients when they come into the health department.
If I didn't have this training, if I didn't have this job, I couldn't have this house, I couldn't have all that I have right now. And I'm happy. I'm happy when I take my suitcase in the morning, go to work. I'm happy to take a bath. I'm happy to be in a good environment and to have a co-worker. Yeah, I'm happy. going to JVS help people change his life, and it changed my life. Thank you. It changed my life.